You are welcome to the talk of today. Here is your Dr. Alfred Egedovo, your primary healthcare specialist. As I discussed with us, we are having preventive primary healthcare initiative through our organization, the Global Health Center. So we use different strategy in poverty reduction and community development. And we have looked into the initiative of starting a project, which I did my first broadcast last week. And today, Friday, is the second broadcast. And we will continue, but as I discussed with us, we tend to use this strategy of primary health care to reduce the burden of diseases that affect resource restricted regions and persons that of less privilege that doesn't have access to primary health care, like some of those common diseases that can be prevented through by adjusting your lifestyle. And we shall be talking today about diabetes. As I told us in this is an information that will guide you to be able to understand what diabetes is all about, and to be able, if in case of critical situation, you can contact the hospital that is close to you. But our objective is to be able to create a platform that enables less privileged people to have access to support that will help them to prevent some of the diseases that are common in our community. Today, as I discuss with us, I will be talking about diabetes. Has been on for some time, and due to based on epidemiology about this very disease, it affects numbers of people, and this is, but however, this has been not very attention has not been paid much to this. Um, so today I am going to shed some light on this in the area of prevention, how we can prevent some of these some of the complications that occur from diabetes. And this has caused a lot of people their fortune. Some have lost their limbs, their legs unexpectedly. They don't understand. Maybe some didn't understand some of the risk factors and some of the things that are involved. And because of that, they get to the end, the terminal part of this process. And some have lost their eyes, which is part of the complication. Some have developed kidney problems, and some have their eyes are blind because of the complication from this disease, this condition. Uh, when we, but you may ask, what is diabetes? It's, it's a problem, it's a condition that occur as a result of lack of insulin. And this insulin, like we have different type of diabetes. Those that started like when some children, when they are born, they have some what is called autoimmune disease. That means there is some cells that just fight against their pancreas, and this can cause problem to them. But today, I will be dwelling on type 2 diabetes. When we talk about diabetes, type 2 diabetes, this is what we call it maturity onset. This maturity onset diabetes start from when you start getting old, and as a result of that, your pancreas would have lose some of the sensitivity um, to be able to produce enough insulin, and because of that, there is kind of an impairment, and the insulins are not sensitive. They are not able to break down the glucose from the food that you eat, because the food that you eat supposed to be metabolized. And when this food is metabolized, this is what goes into your cell to be able to give you strength and be able to function properly. But when this glucose is not driven into the cells, it stays in the blood, and that is why we that is what we call high blood sugar. So there'll be more sugar in your blood, and as a result of that, there are a lot of problems starts occurring, which will lead to you having some symptoms, like you start, some of them, like you start drinking, becoming more tasty. You become tasty on time. Then some people, they lose weight, some, and so a lot of factors, a lot of problems start coming up, and that is why we and when this happen, at the terminal part of it, it has a lot of complications, and this is the reason why we have to address this, because it has affected our society, our community, so that they will know some of the effects of this of the problem of diabetes. The possibility of some people losing their vision, some losing their legs. But these are, if they are checked on time, like this is why we are trying to carry out the preventive primary health care. That is to reduce the impact of this disease condition, so that it will help our health system, and also to limit the impact of this in our community. So there are various ways that we can use to prevent this, which could be by the kind of doing some exercise, and also your eating habits, and there are also some drugs that can still cause the diabetes. So with the knowledge of this will be able to help our populace, our audience, to be able to prevent the complication that comes from diabetes. And we're going to stop the discussion here, but we are going to talk more about diabetes in our next broadcast. Thank you very much.